Hi, fabulous people. I am Dr. Jen. I'm here with Joanne Kaine from the FAB team, and we're here to talk about conscious parenting. And Joanne, thank you so much for being here. I know you have been cooped up in your home in New York with all the beautiful snow around and wearing your nice little cozy sweater. So thanks for being here, Joanne.
Thank you for having me, Dr. Jen.
Yeah. Well, this idea of conscious parenting, right? So, how would you even describe what does that mean to be consciously parenting? Because I definitely think sometimes our children can be our greatest teachers. At the same time, we're also their guides, their teachers in some way, and trying to do that consciously. So, what would you even say? Like, what do you think it means to be a conscious parent? Because I also know you strive for that in your own personal life.
Strive is definitely an optimal word in conscious parenting. Just to give a little framework, I have two daughters of my own. One is 24 years old and she's out in the workforce, and I have a 19-year-old sophomore in college. So I feel like I have gone through the brunt of parenting, especially when my kids were younger. And that's where I established this concept of conscious parenting when my kids were super young, because in therapy, which is how I landed there, because I was having so many challenges with my older daughter in terms of being like a first-time mom, it was so difficult to separate my own emotions and my own baggage, so to speak, from the struggles and challenges that my child was having. And so I came up with conscious parenting as not a tool to become perfect parents or to be parents that always do exactly the right thing, because that's not even possible, but as a practice and a toolbox to teach parents to approach parenting with a higher level of awareness with themselves, and then the dynamic between them and their child.
And what comes to mind for me with what you shared is also how this idea of conscious parenting changes along the developmental spectrum with our children, right? A conversation I seem to be having on both ends, like with this 20 something group. And I have one of those in my life as well. And also, so sort of both sides, like talking to parents, but then also talking to the 20 something clients of this developmental stage of individuating, where we're trying to give these young people space, right, to become their own people, to have them look at what are their values apart from family values, setting different boundaries, working on adulting. And that can be so tricky, I think, for both sides, especially sometimes with this mother-daughter dynamic, is like finding a place to stand. So that's really been a conversation that I've been having in a lot of my sessions right now. So I'm wondering if you could speak to this idea of conscious parenting. Now they're still your children, but they are, and I'm doing air quote, adult children, because they're also in that time where they're not completely independent, right? But they're working on that independence.
Different ages means different stages. And as a parent, it's really important to recognize what age are they at and what's the appropriate stage they're at. And every age and stage is going to have a different evolution. And so you have to, in your consciousness as a parent, recognize what is appropriate at that age and what's not. And so that's a way to look at conscious parenting, is just being aware of the fact that, okay, if my child is 7 years old, or my child's 12 years old, or they're 16, or they're 21, I'm going to have to learn how to respond and deal with different situations, because when they're 7, they're not 21. But what happens, I think, over time, when you're a mom, especially like you were saying, you birth your child and there's this umbilical cord. And yes, the umbilical cord gets cut, right, when the child is born. But that's physically. And then metaphorically speaking, through the different ages and stages of conscious parenting, we have to learn how to literally separate ourselves from the umbilical cord, the tie of being the parent to your child, which is, it has to be appropriate to the age and stage.
Yeah. And what also makes it even more complicated is when there's then an eating disorder involved, right? Hi, this is Dr. Jen. Subscribe to the FAB channel if you're interested in getting more videos, more tips, more strategies about how to get through your eating disorder recovery and to be living your joyful and fulfilling life. Because sometimes then the parents are taking on even more of an active parenting role, because on one hand, I want to say they have to, because that kid is needing more support, maybe more accountability, more guidance than they normally would because of this eating disorder and what is needed to support them. So I think that's the other thing that can get really complex. It's like, whoa, my loved one feels like they've regressed in some way, like they need so much from me as a parent. But then as they start getting better, it's like beginning to sort of loosen those reins again. And like you're saying, the stage and age, like, is it time to sort of transition and give them more space to, okay, I have to let them kind of start flapping their wings again. And that can be really scary, especially if your child was pretty ill at one point with this eating disorder.
So scary. And I think fear is such a strong emotion that as a parent, my mom still says, can you please call me when you get there? Can you let me know that you're okay? And I'm well over middle aged. So I think that there's always going to be that emotion and that strong tie. And it's such a fine line that has to be walked.
Yeah.
And that's where, our own intuition has to come into play too. We have to know ourselves first, right? What are the things that trigger us? Because we project what triggers us to our child.
So important that we're doing our own work. And I know, Joanne, something you did early on when your oldest was having, right, some of that significant attachment to you, and you had to really look for guidance. And I think in FAB, what we found pretty quickly is we really wanted to work with loved ones, whether they were the biological parents. We've had grandparents very involved. We've had siblings. We've had other friends that felt like family to some of our clients. But how important it is to be working with the whole family system. And so for any parent that's listening, one thing I would say is you don't want to have to do this alone. Find your guides, right? We work with families individually, and then we also do a whole group, which I think can be very helpful for parents to hear from each other of what worked in the recovery process. But I know for you, I think when you went for guidance, you thought, okay, I'm going to learn strategies to help my kid. And then pretty soon it was like, oh, hello, Mir. I always remember you telling that story.
Yes. And, when I have the opportunity to work with parents in FAB, it is a beautiful experience to show them, you're not to blame. This is not your fault. And it's an opportunity to keep growing with your child, right? And to grow together as a unit, as a relationship, and as a family. And this is, right, a stumbling block. And it's just a chance to grow. And as you always say, Dr. Jen, what's the takeaway? What's the takeaway?
What's the takeaway? And, I'm going to give a shout out to blended families, because I have been in a blended family for years, and that creates a whole other dynamic, right? How do I walk that line between playing a parental role and at the same time, like not overstepping the boundaries? And I always remember, and honestly, I feel so grateful to have had my kid in my life like the way I have. And honestly, she was pretty easy. But I do remember one time her going, "You're not my mom," right? And it was something like, I don't know, something very small that I was setting a boundary. But wow, did she like, did she push it to say, okay, let's see what she does with this? And, and I also, I remember her saying I was working with a blended family that were having a lot of dynamics. And I remember going to her and I said, well, what would you recommend to my client about being like a parent? And she said, just tell them to be a good friend, like not to play like the mom card, like just to be a good friend. So I guess what we're also pointing out here is like all these additional complexities. And so even more so, like how important it is to have our own guides. And I know that therapist was instrumental to those early stages with your kids, and you have these amazing daughters who are like thriving. And I think that's also, Joanne, because you're always doing your own work, as I know all of us on the team always are.
Yeah, I'm grateful. I'm grateful for the experiences, even though there were many, many rough roads taken. That's the road of
Yeah.
parenting, not always a straight line.
And sometimes we're parents who are, look, this one said, how about me, mom?
Our furry, four-legged ones.
Right,
Yes.
to our furry baby. She wanted to come make an appearance on
Yes.
camera today. Well, Joanne, thank you so much. I'm so looking forward to facilitating group with you, with our beautiful FAB community and all of our loved ones that show up, because I think this is, probably the most important thing, one of the most important things we can take on is this idea of conscious parenting, and it certainly is a work in progress always.
It is, and I'm looking forward to facilitating that group with you. So I'll see you then.
Okay.